today's Health Watch, we look at a groundbreaking new cancer study. Researchers at the American Cancer Society estimate that more than 40% of all cancer fatalities among adults 30 and above in the U.S. could be linked to lifestyle risks that, of course, can be changed. What are those risks? Well, the most impactful, cigarette smoke. Others include excess body weight, alcohol consumption, physical inactivity, and diet. CBS News Chief Medical Correspondent Dr. Jon LaPook is here to break it all down for us. John, good morning to you. If I could translate that list, it's basically drinking, smoking, and sitting around is bad for you. Right. People like drinking, smoking, and sitting around, though. So how do we change?
Exactly. So you're born, you live, and you die. And that middle part, you got to have some fun. Yeah. So it's everything in moderation, including excess, right? And I think one of the problems is that people feel out of control. Cancer, first of all, it's terrifying to so many of us. It must be genetic and there's nothing I can do about it. No, there's a lot you can do about it. Cigarette smoking, obviously, it causes 30% of the deaths that are attributable to, to things that you can actually have a modifiable factor for.
Lifestyle changes.
Lifestyle changes. And then I think that, that's tough to do. We know it's tough to stop smoking. It's easier to never start smoking in the first place. Right. So I would say a report like this should just emphasize to people, give them incentive to say, you know what, I'm never going to start smoking. Then there's some very low-lying fruit. For example, human papillomavirus, that's HPV. We know that it causes cervical cancer in women and cancer of the back of the tongue and throat in men. There is a vaccine against it that can prevent HPV. But fewer than 40% of eligible children actually get the vaccine. That's just low-lying fruit. Then there's hepatitis C. That's a virus that can cause liver cancer. And only about 40% of Americans know they have it, even though there is an easy cure for it, actually, in 8 to 12 weeks of a pill. But they don't know because they're not getting the routine screening test the CDC has recommended at least once in people's lifetime for people who are over the age of 18.
And what happened during the pandemic? I mean, those screenings dropped off even more,
100%. And I saw that in my own practice. People would come back. They didn't go into the doctor's office for all, or the healthcare professional's office, and then you didn't have the mammograms, you didn't have the colonoscopies, you didn't have the routine screenings looking for skin exams. So now that's coming back a little bit, but it absolutely plummeted.
But John, since it's Friday, you said earlier, everything in moderation, including excess. Does that, are you therefore prescribing the occasional hoot nanny on this Friday?
Or if you have kids, hoot no nannies. Just on your own.
Yeah.
Yes.
All right.
Singing's healthy.
That prescription is okay.
I actually believe that singing is great for your health.
Yeah.
I do. So sing a song.
Sing and live a good life. Dr. Jon LaPook, thank you so much.